Good morning, Kalispell. I hope everybody is doing fantastic. So today we're going to talk about arthritis versus arthralgia. So we've been getting a lot of questions this week on what these terms actually mean and whether they're synonymous terms. Do they mean the same thing? When you break it down, no, they don't. But let's jump into it. And a common one that people go and look at is the Mayo Clinic. And I'm just picking on them right now, but it's fairly well across the board. So, for example, the Mayo Clinic states that joint pain refers to arthritis or arthralgia, which is inflammation and pain from within the joint itself. However, many other organizations make a distinction between the two. For example, the Crohn's and Colitis Foundation of America defines arthritis as aching or pain in the joints without swelling. Arthritis is inflammation, pain with swelling of the joints. They also note that you may experience arthralgia in different joints of the body, including your hands, knees, and ankles. And they also go on to explain that arthritis can cause joint swelling and stiffness, as well as joint pain like arthralgia. Similarly, John Hopkins Medicine defines arthritis as inflammation of a joint that causes pain, stiffness, and swelling within the joint, muscle, tendons, ligaments, or bones. Arthralgia, on the other hand, is defined as joint stiffness. However, its symptoms also include pain and swelling, just as with arthritis. Way to murk that water up. Organizations who define arthritis and arthralgia as separate conditions make the distinguishing factor between the symptoms that involve pain or inflammation. So you may not always be diagnosed with arthritis when you have arthralgia, but the opposite doesn't hold true. If you have arthritis, you also have arthralgia. So let's run down some of the symptoms of these. And a lot of these overlap. Let's understand that. For example, both conditions present with stiffness, joint pain, redness, reduced ability to move the joint itself. So those are generally only symptoms of arthralgia. Arthritis, on the other hand, is mainly characterized by swelling of the joints and can be caused by underlying conditions. Like the big ones are autoimmune conditions such as lupus, psoriasis, gout, and there are certain infections that can do it as well. Additional symptoms of arthritis can include joint deformation. So if you've seen people with rheumatoid arthritis, a lot of times their fingers and knuckles will twist. Loss of bone and cartilage leading to complete joint immobility, hence knee replacements, and intense pain from bones scraping together. That's like severe osteoarthritis or inflammatory. So let's go over some causes and risk factors. The joint pain caused by arthritis can be the result of complications from a joint injury, which we see all the time. Obesity, as the excess weight of your body puts more than normal pressure on the joints. Osteoarthritis, which is the wearing away of the cartilage, so you can actually end up with the scraping of your joints together when it's gone. Rheumatoid arthritis, which is where your immune system wears away the membrane around the joints, leading to inflammation and swelling. Excuse me. Arthralgia, on the other hand, has a much wider variety of causes, which aren't necessarily linked to arthritis. So you can end up with sprain and strains of joints, joint dislocations, tendinitis, hypothyroidism, and actually also bone cancer. So a lot of times people ask when you should actually seek medical help, when you should look for help as to what the heck's going on with your body. So around 20% of the adults in the US have been diagnosed with arthritis. That's using the CDC's most recent statistic on it. but it's not always easy to tell if you have arthritis, arthralgia, or another condition going on. Arthralgia can be linked to many different conditions, and you may think you have arthritis when your arthralgia is actually a symptom of an underlying condition. Joint conditions share a lot of similar symptoms, so you should talk to a doctor about it to see what the heck's going on. You should seek immediate care if an injury causes joint pain, especially if it's intense and it's accompanied by swelling and it comes on rather quick. You should also go in and get help right away if you can't move your joints. So now diagnosing the difference between the two. Not all joint pain is an emergency. So if you have mild to moderate, let's say, pain, you should make an appointment with the doctor of your choosing. If the joint pain includes redness, swelling, or tenderness, your immune system could be suppressed, or you might have some sort of diabetic condition going on. You should go in right away. So there is some testing you can do for arthritis and for arthralgia. So on the arthritis side of things, you can do blood tests such as an ESR, which stands for erythrocyte sedimentation rate, or C-reactive protein. There's quite a few others. You can go for rheumatoid factor, CCP tests. You can actually have the joint aspirated. In that case, they'd be looking for bacteria, cyst, or gout. Or you can do a biopsy of the joint tissue. So arthritis can have some serious complications if you leave it untreated, or if an underlying condition isn't properly diagnosed or caught right away. So the big ones that we look at in this scenario would be lupus, psoriasis, and gout. They can cause some pretty wicked things. So now we get on to home treatments. Um, Before we get there, though, we would just like people to know in the spine, if the spine becomes immobilized, aka you have a subluxation, the bone's out of place in your spine, so joint fixation, your body will actually start the process of developing arthritis in as little as 3 days. There's actually been MRIs done, and that's where you can see it starting. And you'll actually end up with joint ulcerations at 30 days. So if you really look at it, little scoops of bone will actually start to be taken out. So some things you can do at home. Exercise every day for at least a half hour. Or if you have severe joint pains, look at something where you don't have to have high impact. So swimming, doing the elliptical, just get the pressure off the joints. Relaxation techniques can help. Even just for surface value, you could use a hot or a cold pack to help reduce the joint pain and the stiffness. Pretty neat, pretty cool. Jumping into the medical treatment of things, they would look at things like on the low end, starting with aspirin or Tylenol. And then actually once you step up into like the inflammatory arthropathies like RA, so rheumatoid, you would be looking at that classification of drugs, or biologic drugs in the case of psoriatic arthritis, or in the severe scale of things, and this could be an osteoarthritis type thing, or just a really bad inflammatory arthritis thing, but joint replacement or reconstruction surgery. So, as always, if you guys have any questions or comments, make sure you shoot them over to us in a message, and we will do our best to get back to you as soon as we can. Have a great day.